I'll turn it over to Nicole, and Nicole, I will pull up the document we're going to share.
Great, thank you, Mary. Hello, everyone. We had a question that was brought up in one of these calls previously that was about concerns of child welfare during this time of increased isolation and families experiencing more stress in a lot of cases. So we have invited Abby Patterson from Prevent Child Abuse Iowa to be on the call today and to share some information and resources on this topic that will be helpful for programs and for mentors specifically. This handout is for you to share with your mentors in your program. So let's see if, Abby, are you on the call yet with us today?
Yes, I was able to join. Sorry about that.
Oh, wonderful. No, thank you so much. We really appreciate you joining the call and sharing this, this information with our programs today.
Okay. Well, sorry I missed the introduction. Nicole, I appreciate you reaching out and asking about some information about what mentors could do. You know, if they see concerns or have concerns, maybe how to handle that. And so I just kind of threw together a couple of things about, you know, we know families are really stressed right now. And we also know a lot of people that would normally see children and maybe report concerns are not seeing those kids. So the number one thing that I wanted to start with was really focusing on that family engagement piece. We'd so much, you know, coming from a prevention world, we'd so much rather see, you know, if a family's struggling, let's figure out what we need to do to help them get what they need or get back on track whenever we can. So really trying to think about things from an upstream mindset and a really strength-based approach to figuring out what families need and how we can help. And then also, of course, if you have concerns, we always want people to feel comfortable reporting. Nicole, you shared that the people, a lot of the volunteers that are seeing kids wouldn't necessarily fit the definition of a mandatory reporter, but that doesn't necessarily mean that they can't report. It just means that they're not required by law to do so. Just because somebody's not a mandatory reporter, if you're seeing kids and you potentially have kind of that insight into what's going on with the family, there is a free mandatory reporter training on the DHS website, and I've included it in this resource that really walks through what's considered abuse under Iowa law and then how to report and a little bit about that process. It's a free online training, and it's, I want to say it's about a couple of hours. I would encourage everybody to take that, even if you're not a mandatory reporter, just to have the education about what is abuse, you know, kind of what constitutes it. There's a million different scenarios that we could go over, but it does help put some like concrete steps into place. Just to help people figure out, you know, is what I'm seeing normal? Is it not normal? Yeah, I don't know. And I'm not sure if you have some questions or if there's anything in particular that you wanted to discuss.
Yeah, thank you so much, Abby. I know that our programs at this time are aware of how important their engagement and check-ins with the family is right now, and a lot of the programs are thinking very creatively about how they can really increase their family engagement and get a hold of people, even when it's hard to get a hold of and phones aren't always being answered. But that when you know, the youth are cut off from some of their regular contacts to the outside world and other caring adults in their lives, that, you know, this, the mentoring relationship and program is just, you know, all that more essential in having that contact with another caring adult outside of the family. So it's great to hear from your perspective, from the prevention side, confirming how important that is. And I think this handout, there's a question in the chat if we will be sending this out, and we will be. We appreciate you developing it for us, and programs can share with the mentors, as mentors might have some questions of their own at this time about, you know, I'm used to meeting with my mentee in person, and now it's different, whether it's on the phone or video chat, and just wanting to be aware of, you know, red flags or signs that would get someone's attention, or that the mentor would want to bring to the mentoring program staff. We know that they've all been trained that if they do have a concern, to bring it to the mentoring program staff, but kind of highlighting that information and confirming with them that they're, you know, doing what they need to be doing just by having contact with the kiddos at this time. So thank you so much. Is there any questions from anyone on the call that you would like to ask Abby at this time? You can unmute yourself or type in the chat.
And Abby, I'll just add, I really appreciate the questions. I know everyone's kind of been refining their monitoring questions, and, you know, Kathy reinforced that in the chat as well. The specific question, how you spend your days, is really open-ended questions and kind of getting some feel about what's going on in their particular situation. So yeah, like Nicole said, you can put something in chat or just unmute yourself. We have our prevention expert here with us today, Abby, so this is your chance. I know she has your contact information there for you to follow up, but if you have any particular question for her right now, go ahead.
This is Kathy Schwartzoff from Helping Services. I think one of the things that's unique to us now is it feels to me like our eyes we're not seeing them much. So that's one thing for the masses. The other thing is the mentors aren't seeing the kids and the parent or guardian as often. So it's almost like, you know, our sets of eyes, including the ones you said with school and medical professionals and all that kind of stuff, it's putting us in a little different situation, making our contact with them even that more important to ask those open-ended questions. So I just talked to a couple of families saying, hey, how are you doing? And they're like, fine. And it's just kind of that grocery store fine, I feel like sometimes, but then other people do share things. So I guess, you know, normally we see them, the mentors see them more, but it's just kind of a different predicament. And not that I expect any response from that, Abby, but just our sense of it's very different.
Well, yeah, definitely. And the one thing I'll say is one of the biggest signs for kids that they're feeling super stressed is behavioral changes. And because of the context of COVID and because of the context and how you're meeting with the kids virtually instead of maybe face-to-face, that might look different anyways. But, you know, I guess the other thing I would say is accolades to everybody for being flexible and adapting to the situation so that you are still seeing the kids, because it is so important. And then maybe one of the other open-ended questions I thought of, or that your comment kind of triggered, was, what are you looking forward to the most, you know, once you go back to school or once we're able to meet in person, instead of like, you know, kind of how are you at, what are you asking something specific that's not a yes or no. But I definitely agree. We get a lot of that grocery store fine kinds of responses.
Thank you.
Great, thanks, Kathy. Does anybody else have any questions or comments that you wanted to bring up about this topic? Okay, great. Well, Abby, thank you so much for joining us, especially on such short notice. We really appreciate it, and for sharing your contact information. That's great. We will share this handout. And as Abby mentioned, there's just because the mentors aren't required by law to be mandatory reporters, that training is available. So if you're looking for options to add to your trainings for mentors that are available, that's one thing. That's a training that you could add as well. So thank you, Abby. Appreciate it.
One last thing, and then I'm going to pop off. The number to report abuse is on there. We don't, at Prevent Child Abuse Iowa, we don't take abuse calls, but we sometimes will field calls about people that have questions about the reporting process itself, or where do they call, or how do they make a report, or maybe why DHS didn't accept a report. And so we can sometimes shed light on that. If people have questions about a specific situation, maybe not even to make a report, we can certainly help with some of those calls as well. And so our number is on there. And then Nicole, if you want, I can also provide my cell phone. We're all working remotely right now, so the best way to reach me by phone these days is by cell. But thank you to all the mentor programs for what you do, and thanks for reaching out. Feel free to contact us if you have any questions.
Thanks so much, Abby. Just great reminder of the great resource that Prevent Child Abuse is at this time and always. And we know they've been a great partner for us with our mentoring program. So appreciate all that you do and for joining us today.
All right. Thank you.
Bye-bye.
Thanks, Abby.
Have a good one.
So a couple of other things that were asked in the chat box to discuss is exactly what we're going to talk about today, because it's come up, asking about resuming face-to-face mentoring and group activities and protocols, protective measures, and placement matches resume. So Kristen, when we share this information, let's make sure that we're addressing your particular question there too. So I'm going to share a document we put together, some guidelines for resuming. And this is based on some other affiliates and nationally what we've been talking about. So let me make sure I can find the correct document. Oh. There we go. Okay, we'll get this shared. There we go. All right, there you go. Ignore my header thing. I'm not going to try to close the header footer. There we go. All right, Chad, do you want to?
Yeah. So as Mary said, this is something that's been shared kind of from some of our other partner affiliates around the country and in conversation with Mentor National. Just some thoughts and considerations of, how we resume, our operations, our programs when we're able to. Kind of the first thing to note too is this is should not be considered legal advice. Rather, it's just guidance for you to think about and consider as a program and organization. And then a couple other things to kind of, I would say, consider and to think about before we walk through some of these things, or as you read through some of these bullet points on here too, is the thought that mentoring isn't going away just because COVID is here and interrupting our services. Mentoring is going to be continuing to be a need, and probably even more so across the country and in our communities, after this is kind of, we're past some of this and there's some other things in place for safety. And so, I think one thing to think about is, because of what we're in, there's a lot of things for safety that we're considering, in-person contact and limiting that, and kind of that personal distancing and things like that, is that think about what your program would look like and how it could operate under these circumstances if this stays in place for a little bit longer, or if it comes back this fall and winter. Like, there are some predictions it could, and there's a lot of unknown. But what could stay as is, and what would have to change, might be a thing to think about, which I'm sure a lot of you are. But I would also kind of put out there too that, from the commission side of things with Volunteer Iowa and Iowa Mentoring Partnership, we are still going to support volunteering and service and mentoring. And so, is there anything that we could do from our angle to support that? So if you are facing like, hey, we feel we have a good plan in place and we have a good, safety protocol in place, but we're meeting, pushback from leadership, board members, or other partners to do this, we would be happy to have conversations to talk about, ways we support it, and this type of conversation that we're having as well, because we want to make sure that support for volunteering stays strong as it is within the state. And so you're part of that mission for us. So as we look at this document of some considerations and thought and guidelines, continue, if you have a partner that you work with for implementing your program, whether a lot of them I know is school districts or another parent organization, make sure that you're talking with them in these, as you put recommendations together, and as you think about how you resume your in-person mentoring part of your program. Another thing too is thinking about insurance and determining, does your carrier have any restrictions or guidelines also that you want to put in place or need to, think about when you're putting guidelines together for this. Think about what you might do as opt-in options. So maybe continuing some virtual with the option to do some opt-in or some optional type activities. So in the document just kind of goes through some of these thoughts and things to think about as you're writing and maybe updating some policies and procedures, even if it's a temporary policy and procedure that you are updating and putting in place until we can be back to a new normal. Think about additional trainings that you might want to implement during this time frame as well. What does that look like? And what could those be? Is it other safety type training aspects? And maybe it's just enhancing some of the training you have already. And then whatever is new or different, just understanding any new people you bring on board, it's just going to be part of that. But for existing matches, having them understand the new guidelines and expectations. So is there a new document you want people to sign because of the enhanced, protocols you have in place and things like that. So, and in the end, you just want to, follow any local and state federal guidelines that are out there. I know Mary will keep the field updated and keep us updated across the state of what that looks like. But you want to do what you feel comfortable and safe with. And, I think it's okay to do some things, and it's okay if you don't want to do some things at a certain time. But know that, we're here to support and talk through those conversations with you and provide those updates. So with that, I will stop and see if there are questions, as well as Mary, if you have any any other thoughts to add?
Yes, and we'd like to thank Natalie Driscoll for her added discussion to this conversation. So Chad would probably gladly mute and be off of this for a little bit. But just, I guess our guidance is really to err on the side of caution. And like we said, having folks opt in and just really being clear about your communication, what your expectations are in the match, and just being very clear with everyone about that there's some training they have to go through so they know what the protocol is going to be. So everyone can just be on the same page, respecting, you know, if you have mentors that are vulnerable populations, you may have students with mentees with underlying medical conditions too, and just really respecting that as far as if they're going to, or the time frame from moving back to in-person mentoring. The documents at the bottom, you're probably familiar with the public health, Iowa Public Health website, and then the COVID-19 is the Iowa coronavirus website. And the middle one, the CDC guidelines for youth programs, is for like camps and youth group activities. So I think that would be a good guidance to look at for protocols for group activities, which that is a whole, that's a whole different level and number of people coming together than having your matches meeting and resuming just the one-to-one matches too. So I think that's an excellent resource too. And again, we will send this document out as well, a follow-up from this call. So Colleen just threw out there in the chat, what time frame are other agencies looking at for starting face-to-face? I think that is a great question to hear what other people are thinking. If you want to throw that in the chat box, or if anyone wants to unmute and tell us a little bit about discussion in your agency for your program, that would be great to hear what other programs are looking at doing. So while we're waiting for some of those answers, obviously, it is different county by county and in different areas, and depending how wide, what a large area your program covers too, which would impact your decision, because this obviously does vary across the state. And we've had counties that have been open with fewer restrictions for a couple weeks now, and then the last 22 counties were just open very recently too. So we'll have to see if that has an effect in the next couple weeks too on the number of positive cases we're seeing. So Colleen says our agency is still working remotely from home until further notice, and some of the counties I've started opening. Yeah, well now everyone across the state is open under the same limited opening. So. Yolanda in Waterloo says we're looking at July for face-to-face so we can thoroughly vet all our options, preferring to keep closely watching our county case numbers. Yeah, and Black Hawk County certainly has, had a large number of cases as well. So yeah, just knowing that this is going to look different in different areas. So Colleen's asking for a rural area, but I know there's been a little bit of an outbreak that area too. I didn't know if there are other rural areas have what they're thinking about. Kristen in Woodbury County said they're thinking July 1. Yeah, and you're certainly been a hot spot up there too. So, and tentatively working from home. Yeah. Any of the rural areas, have a response about what they're looking at? Jamie, I don't know what you guys have talked about in Carroll County out that way too, or I don't know if Mills County's on.
We haven't, I mean, I think they're actually having a meeting about it right now.
Yeah.
But we've kind of just been playing it by ear. A lot of, we've actually had new cases around here.
Right, okay.
Recently. So yeah, we're kind of not sure again when we're going to start doing face-to-face yet. Hopefully yeah. July sounds good, but yeah, we're not sure.
Yeah, and I think that's what everybody's doing, just monitoring, the ever changing data. So I guess what this guideline is asking you to think about is what is that going to look like, and what are your protocols and practices going to be as you move to face-to-face, and getting that document ready for whatever your timeline looks at. And so you and putting together something that you're able to share with your mentors and your mentees and families as well. Obviously, talking about the family engagement too, just communicating with the family so they know that you're thinking of the safety of the matches as you move forward. Bailey is in Mills County. Glenwood, I think we'll be waiting until we can do our group mentoring. If it's not safe enough to meet in a group, then they won't be doing the one-on-one either. Yeah, community-based mentoring, picking up the cards. I know we can have all the protocol for being outside and being 6 feet apart and that kind of thing, but transportation would certainly be an issue. Thinking about being in car in close quarters, which really would not be the safe social distancing too. So how do we work around that and creating some meeting spaces? Thanks for sharing those ideas. Does anyone have, if you have further responses on that or any other questions further you'd like to share, things you're thinking about as we are reopening little by little? And people are slowly moving back to the office, it looks like. Yolanda said in Waterloo, they're moving back half-time and then 80%. And depending on your office space too, perhaps there's some staggered work times too, or days, staggering days, so you're not too close. That's a situation I think we're going to be in a little bit in our office when we're looking at, we're looking at going back. It'll be, it's going to be June before we know it. So it'll be June at least, and some might be heading back. Thanks, Kathy, so it's really helpful. One other thing I will send out with our, a couple things I'm going to send out with the follow-up too, did have some other information on closure. We've talked about closure, but just some other information to share, and maybe getting mentors to think about this, how serious it is when young people are missing out on these, if they've not been having match meetings, or just kind of grieving the ending of it. This year is going to be a little bit different than other match closures if they're coming to close at the end of the school year for the summer. And the other thing, if you hadn't seen, Iowa Economic Development is doing a second survey of recovery for businesses, the next step. And we worked with them a little bit to have some questions in there for nonprofits and keep trying to be the voice for nonprofits, and that's not forgotten in this. So I will send that link out. It's we really encourage you to respond to that so they hear this sector. And when I say nonprofits too, our school-based too, and just mentoring programs should respond to this as well. So please take some time to do that, and that is something they're looking for answers to yet this week. Yeah, and Colleen says, can you stop them or just offer the guidelines? So you may have protocol. We can't mandate what your programs are doing across the state. We do not have that authority. But if someone's participating in your program, you certainly can make, you make the rules about how they meet and safely meet. And this is part of it, like their health safety. This is part of it as well. So you can certainly tell them no, they're not allowed to meet. And again, I say err on the caution of safety, just because you would not want to be known as, oh yeah, that mentoring program had that really cool group activity, and then they had an outbreak from that. You don't want to be that, or even if you're encouraging matches just to meet without a group activity too, just would not want you to be the source for that. So you do have that. That's well within your, your agency's rights to say these are the rules. We're not allowing matches to meet yet. So we will send these documents out that we shared today, as well as those couple of other things we mentioned. At this time, we're thinking we'll go back to our regular monthly peer share calls instead of every other week, unless we hear otherwise. And always I appreciate people saying at the beginning of this chat, like what they were interested in hearing about today. And usually we hear things come up on the call, but anytime, if you have questions or concern, I know we've talked a little bit looking at guidelines, if we should go back to virtual again in the fall, once we get back to normal that we're looking at now. Anyway, that'll be our next step too, like what are like some long-term considerations, and we'll continue to have those discussions. But if something comes up and we're hearing from several programs, obviously we can address that on upcoming calls too. I think one thing we'll probably be looking at too is like some fundraising ideas or like some things we can do virtually. I have found some resources about that and just ways to engage people in virtual fundraising too, which I know just sustainability of programs obviously is of concern to you, and it's of concern to us as well, that we want all the great work you do to continue. So that is all we have for today. So unless anyone wants to unmute and has something else to pose or share to the group, or wants to put something in the chat, we'll wrap up for today. We'll be on for just a little bit if somebody else has something they want to share. So thanks again for your continued great work and engagement, and we'll talk soon.